And again, my name is Minister Sonya Hosey, and I am with the More for Sisters is the nonprofit. The actual program is called She Speak Wellness. My purpose is to speak to Black women who leads nonprofits. And the whole purpose is to bring awareness because a lot of times our community is not aware of some of the issues that is important for us to address, especially as it's around disparities, uh,
Mhm.
around different health issues and health equity, all of these different things that impact our community. So I want you to talk a little bit about where did it first start? Where did Black Mamas first start? How did that get into your spirit and your soul that there was a need?
Well, I would definitely want to start by giving recognition to Dr. Michelle Roundtree. She was the actual founder of the organization in the form of Black Mamas Community Collective. She created the collective um, as part of actually a community-based research project. So at the time, she was a professor at UT in the School of Social Work. She's also a Black mom with, you know, who's experienced
Mhm.
who's had the experience of Black motherhood, and she started this project based on a lot of research that had been coming out around the time, which was about 2018, 2017, really,
Okay.
that was talking about how Black women experience worse birth outcomes, experience more mortality or morbidity, so more deaths and more complications as a result of childbirth,
Mhm.
and than any other group in the country, and then especially than their white counterparts and Hispanic counterparts. And so that research, on top of other research that was coming out saying doulas help improve outcomes, especially for Black women, and Black mothers, Black birthing folks, and that the research around, this being such a multifaceted issue, a structural issue. It's not about just the woman, like a Black woman who is um, socioeconomically well off,
Right.
or a Black woman with a doctorate still had worse outcomes than a white woman without a high school diploma.
Right. Right.
Right.
Right.
So it was something bigger than how much money we had or how much education we have or what we were doing with our lifestyle. It's a bigger issue. So this research, she wanted to see if providing doula support for Black women will help outcomes here locally. And
Mhm.
that's really what got us started. She pulled together community members, and I got pulled in among
Right. Right. Which is good.
those. And yeah, that's where it began. And by the next year, by 2019, we as a community had agreed and went in the direction of, hey, this isn't a research project, really. We need this in our community for good as a
Absolutely.
permanent community organization. So we
Right.
shifted away from it being a research project, and it has now been running as a community organization since then.
What you said a lot. And one of the things that there was so many nuggets that came out of it. About how many women are you serving now?
In 2023, I just recently counted up the numbers. Our doulas supported 75 women
About
last
70
year.
women. Okay,
Mhm.
is it a majority here in Central Texas,
All
Austin?
of them. Yeah.
Okay, okay,
hmm So we
okay.
serve the Central Texas area. So specifically 5 counties: Travis County, Williamson County, Bastrop County, and Caldwell and Hayes counties. So anyone within this 5 county metro around Austin
Mhm.
they can get our services
Mhm.
at no cost.
Mhm.
So,
Why do you believe, and of course, this has nothing to do with socioeconomic, it has nothing to do with your education, it has nothing to do with anything. But how do you believe that the medical system has addressed this population? What are you seeing as a result of some of the inequalities when you're first looking at this?
well, a lot of the weight of the disparity lies within the healthcare system and the medical system, and how they have historically and how they currently treat Black folks in hospitals. And it's across the board. It's not just pregnancy, it's in pain relief, it's
Mhm,
in um, chronic disease management,
mm,
it's an infection. We have seen across the board that Black people, the Black community has worse outcomes, and part of that, and we also have seen that there is bias. The
mm,
healthcare providers have implicit bias that makes them assume, for example, coming back to pregnancy, a lot of them Medicaid doesn't pay as well as private insurance. And
mhm.
a lot of them see a Black person coming in to give birth in a hospital, they assume they're a Medicaid patient. And although that does not mean they should not get the same service, the fact
Right.
is they don't get the same level of care and support. And it's just automatic, whether or not you're actually on private insurance or Medicaid, it
Mm,
just is a tendency due to this implicit bias in the healthcare system that's so many healthcare providers have.
right.
Um, they are aware, a lot of them are aware of the disparity. Like, it's been publicly discussed in a lot of spaces and by a lot of famous people too. Serena Williams,
Right.
Beyonce, like
Right.
A
Right.
lot of folks have discussed it. Um, so they're aware of it, but it's just such a big, like, one, you have to change something. They're not even implicit bias. They're not even aware of their biases. So we have to
Right.
change that. So
Right.
it comes back
Right.
down to fundamentally, how do you see these people that you consider other? But then, like, people are, they talk about quality improvement and they talk about making changes, but the changes don't get made because the underlying issues of, honestly, systemic racism is
Mhm.
still there.
Right. 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 What are ways that as women, what can we do to prepare ourselves as we go into seeing the doctors? And again, there could be multiple issues that we're going in, but what are ways that we can educate ourselves, and what tools and strategies would you say that we need?
The things that we need, I think one of the biggest things we need is having support and having supportive community around us during and after pregnancy, and especially at labor. A doula, one of the reasons a doula is so valuable and actually helps change or improve people's outcomes is because they've already discussed beforehand, what do you want for this birth? Like, what are your choices? What are your decisions? Let's talk about it now while you're not in pain,
Mhm.
while you're not medicated, and let's make
Right,
those decisions and write them down and make sure everyone there is aware of it, and that's called a birth plan. Doulas may also help with a postpartum plan, because while that after that person gives birth, they're really supposed to be resting.
right,
But if they don't have a plan for how are they going to get food, who's going to help them with the baby, who's going to help them get sleep, that sort of
right,
thing.
right.
They that makes a difference. So a doula is helpful before, after, and during the fact, because during the birth, they know the birth plan, or they're aware of what the person needs and wants. They also help translate when the doctor and medical staff are saying all these medical terminologies and
Right,
saying this
right,
is what's happening, and it sounds scary. okay, the doula can now translate it back to regular language and say, okay, so here's what's going on. The baby's facing in this direction, and we need, this to happen. And here are some of the options. This is what we can do. This is what they can do. And here's what they're offering. But you have options of what you can do, and let's decide how we address it, right? So
Mhm.
having a doula there helps. If you have, like, if you have a supportive person there, a lot of times it's either the spouse or the mother, right?
Right,
So the baby's grandmother,
right,
yeah,
right, right,
and
right,
having those people be supportive as well and aware of this is the mom's needs. We need to make sure we're not creating a stressful environment for her.
mhm,
Instead, we're helping in, helping them relieve pain. Sometimes they just need somebody to hold on to,
right,
helping them
right,
with their helping them through the experience and supporting them and being that supportive guide with them or supportive person with them. So it's not just the doula, family is important too.
right,
So having the kind of awareness around birth and around building community for that birthing person in family, as well as potentially having doulas, or at
mhm,
least having the education and the preparation, I think that could make a difference, like in our community itself, or like needing that specific type of support. It's
right,
really important because um, we don't control the doctors, we don't control the
mhm,
nurses,
mhm, mhm.
but if we don't control our spouse or our parents either, but if they understand their role and how important their support is and how important it is for them to help the birthing mom through this process
Right,
in a peaceful, calm
right, right,
environment, it's gonna make, I think it's gonna make a big difference for a lot of people just within our
right.
community.
Right, and I know for certain, women need support from, I mean, everyone in a sense, because I can, well, it's been a long time, since, my children, but I'm certain that there's a need for as much support as, as possible. How do you all do your outreach?
A lot of our folks right now are either word of mouth
Mhm, mhm.
or they were searching for us online or they follow our social media. So we have a lot of millennials and some Gen Zs coming in. So a lot of folks are online on social media and learning about us that way. But we do have relationship, particularly with community care clinics, but we have relationships and some people who are healthcare providers will tell their folks, their Black patients, hey, this is available. So some folks refer us as well.
And so, I primarily work with the faith community. And
Mhm.
one of the things that we have, and when I say we, what I've seen is that there continues to be a push that our faith communities become more aware about all of the issues, majority of the issues that their congregation is dealing with. One of the things that I believe is that the faith communities um, must continue to learn about how to support their congregation. Um, there's so many different areas, and I know for certain that the faith community cannot address all of them. However, I do know that it is important, and I'm clergy, to find ways to support our women in the congregation, but also to deal with families with chronic health and then prevention. Prevention.
Mhm.
Is there any kind of preventative types of services that you provide, especially for those who may be sexually active or whatever? Is there any kind of preventative things that you provide? And also, what are ways that we as a community can help and support?
Yeah, that's a really important question. Well, if we're talking short term, like someone who is pregnant and we want to prevent negative outcomes of the pregnancy and postpartum, one of the things we do that I think is helpful for everyone we serve, anyone who's getting our doula services, they also get free mental health support. They are able to get free therapy from Black therapists specifically. And that helps some of them deal with the anxiety, and it helps curb things that could turn into postpartum depression, which is a big issue. So that's one of the preventative services. And they also have access to that therapy through 1 year postpartum. So it really is important and valuable for them. I do think so. We also are connected and networked in our community. So we may not do all of the preventative type services, but we can direct you. There are some amazing organizations. One I can think of is Allure Alliance.
Okay.
I'm talking right now, if I'm saying an organization, it's a Black-led organization.
Uh-huh.
Allure Alliance, they do sexual health education and
Yeah.
as well as preventative support, helping people
Okay.
get access to um like any birth control they may need, or but really and truly their focus is understanding your sexual health and being able to make the decisions before or after or at any point in time.
Right.
And then there are organizations that help with um, domestic violence and intimate partner violence, two
Okay.
of which are Saffron Trust. There's No More, No Mass, and I know there's another one that I am
Right.
not remembering right now, but there are at least three Black-led organizations that address intimate partner violence locally.
Right.
And that's a really important thing that we need to prevent that affects our moms. Physical health. One of the things we do is we have a girl trek walking group. You don't have to be one of our clients to be in it. You just have to be a Black woman. And
Mhm.
we walk around, usually it's around Mueller Lake on a Saturday morning. And this is getting us moving and helping us to have healthier hearts. People who are pregnant can still get their movement in because walking is a exercise you can
Exactly.
do while you're
Exactly.
pregnant, you know?
Exactly.
So
Exactly.
that's a preventative activity as well. So any spaces where you could get moving, any spaces where you could get the additional resources and help you need. Um, a lot of times there are folks out there, or uh the folks who you're connected to in these organizations, we all talk. Hopefully, we're all talking, and they can
Right.
connect you to who else they may know who can get you, say, food or help you get rent support and that sort of thing.
Right. 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 There's a few organizations that you mentioned that I am familiar with, and I'm familiar with some of the individuals. One of the things that that as we're talking, it is so important that our community have the trust of the providers,
Hmm.
those who understand our background, um, the way that we are as a Black community. And so one of the things that you stated is that a lot of the counselors, providers are African American, Black, people of color, that help support them. And it is so important for us as a community that we begin to identify what are some of those resources that is available. This kind of conversation is very important, and I believe that we can continue to expand um, our network so we can know each other by
Exactly.
name, by name.
Hmm.
And because once we begin to know each other by name, that's where the trust comes in, because now I can come to you and say, look, these are the services that's being provided. These are
Yeah.
the services, the other services. And so this is the reason why I had a desire to speak to a lot of our nonprofits, because I believe we as a community need to continue to advocate for that.
Yes, we
The
need to
beauty,
advocate. We
yes,
need to connect. We
we
need
have
to
to.
collaborate.
Exactly,
Hmm.
exactly. The other program that I'm with is through the Abundant Life Church, and
Hmm.
we are developing a wellness program. And uh, for that wellness program, we are trying diligently to make connections to the Black community. We
Hmm.
recently have partnered with an organization that we have locked arms together. Um, and it's a very wonderful program. And so, one of the things that I will continue to do, I'm going to continue to reach out to organizations that are Black led, that
That's
are Black
wonderful.
led, that are doing some awesome things. And so I really appreciate you coming and talking um, with me, because I know for certain there's going to be another opportunity to actually see your face, and to embrace and to do all those different things that we, need to do,
Yes.
because a lot of times we need to touch each other to get that.
Be in community with each other.
Yeah,
Yes.
to have that intimate kind of conversation. And I
Hmm.
am hopeful that these conversations will continue in any means as possible. I'm going to also plug in, because I'm involved with the Central Texas African American Family Support Conference. I
Hmm.
hope you come. It's going to be in the month of February. Uh,
Hmm.
this is where our family, and I can say that I've been involved with the conference for about 20 years or so, but it
Hmm.
is such a beauty because we're coming together as a family to address
Hmm.
the things that are so important. So
Yeah.
if you're not, if you haven't heard about it, please go on to the website, which is the Central Texas African American Family Support Conference. Look at some of the things that they have done in the past, and then also come and be a part of the family. I'm certain and I'm going to also give a plug
Mhm.
to the Hog Foundation. And I
Yeah.
believe your organization is a part of the 4ABHN. I seem like I met someone that may have been at the meeting, but I'm not sure. But again, I'm going to do a plug in. I'm going to do a plug for the 4ABHN, along with the Central
Mhm.
Texas Network, Central Texas African American Family Support Network. I'm going to give a plug for my
Yes.
wellness, because we're still trying to reach out, and me specifically trying to reach out to the African American women who are
Mhm.
online, who has a passion, who understands the needs of our women. And then I'm going to give a plug to Abundant Life for the holistic wellness program. We are beginning to reach out to our Pflugerville, Central Texas, Manor, and then also the Taylor areas to do some
Mhm.
work. And I believe Black Mamas is in Taylor, right? Are you expanded to Taylor, maybe?
Well, we do serve folks in Taylor, but there's actually another organization that's specifically working with as an organization in Taylor. It's not us, but we work closely with them. It's called Healing Hands Community
Okay.
Doula Project.
Okay.
But Taylor is within our scope as well.
In your reach. Okay. Okay.
Hmm.
Now I'm getting ready to end the interview. Again, I thank you uh
Okay.
so much, so much. What would be the last thing that you would want people to know?
I would want folks to know that Black Mamas ATX is continuing to find ways to support our Black mothers and birthing folks in community. And when I say in community, with other people and with other organizations. So it's been an example of how we build community together instead of working in silos. So reach out to us, participate in our sister circle community, participate in our Go Trek walks, our mamas meetups. But beyond that, just stay connected with us and with all the other Black-led organizations, because there are so many people doing important work,
Mhm,
and we work together to uplift our community. And
mhm,
that's the key important thing.
mhm, mhm. Now, the last thing that I'm going to say, pronounce your name, and
Yes.
also not only pronounce your name, but give us a line about who you are personally,
Okay.
who you are.
So my name is Kelenne Blake. My first name is actually an Igbo name that my mom got from a book. So Kele means thank and Ene means mother. So my name means thank mother. So I'm
Oh,
in the perfect line of work.
exactly, exactly, exactly. That is awesome. But again, thank you so much for being here. I know for certain I'm going to see your face again somewhere, somewhere. But
Absolutely.
again, thank you so much for having this conversation with you.